So this video is for lash lift. So we're going to start our video as we would if we just arrived to work. So the first thing that you want to do when you get to work is, of course, wash your hands. So you're going to go to the sink, wet your hands, get that liquid hand soap. You're going to wash your hands down to your wrists. You're going to wash the back of your hands down to your wrists. You're going to wash your fingers. You're going to wash the back of your fingers. You're going to wash between your fingers and your thumbs, fingertips and nails. You're going to wash your thumbs. You're going to wash your wrists. And you're going to do all of that for a minimum of 20 to 30 seconds. Then you can rinse thoroughly under the sink. Once you have a proper rinse, you want to find disposable paper towels or towels. Turn the water off. Dry your hands thoroughly. If it's disposable paper towels, toss it. If it's a clean towel, you can put it in a closed container until it's time for laundry. And then you're going to get that hand sanitizer, 70% ethyl alcohol, and you are going to wash those hands with your sanitizer just like you did with your liquid hand soap. And now you need to prepare your room for your client because you have the lash lift to do. So let's talk about how we do that. We are going to disinfect our workstation, bed, and equipment using a disinfectant wipe. Of course, we're going to follow manufacturer's instructions. We will check equipment to ensure all devices are in a safe working order, plugged into a working receptacle. We will dispense products that are needed for the service. So how we do that is we prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring that the tip of the nozzle does not come into contact with the disposable portion cup tray, or we can remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We will drape the facial bed using one fitted sheet, one flat sheet, and 3 towels. We'll place clean laundered sheets down on a disinfected facial bed, placing a towel horizontally at the head of the bed. We'll lay a hairnet and a headband on top of the first towel along with a rolled towel to support the head and neck of the client. We'll save the third towel to lay across the client's décolleté, or you can use disposable table paper to drape the bed. So now we have to greet our client and get her situated, but let's go over what we have on our tray for our lash lift service. So what we have is, just move so that you can see this, on the tray, on the chair here, we have some warm water for the end. We have, here, I'll turn so that you can see a little bit better, disposable gloves because you wear gloves in this service. We have iPads. We have our rods and our lash lifting tool. We have our lash glue. We have some single-use applicators. We're going to pretend like those are our brushes and stuff when we get to that point. Cotton rounds. We always have some gauze squares. We have makeup remover. We have our lash lifting lotion. We have our setting lotion. We have like a petrolatum type, like Vaseline, to go under our iPads. And then we have a nice little cover to go over while the setting lotion's on, for just to give her that little rest moment. So we have all of that on our tray ready to go. I even have a disposable mascara on if I need it. And then it is time to go and meet and greet the client. So meeting with the client, we would always do that, approach the client with clean hands. So just so you know, I am going to wash my hands again before the service, but when I meet to do the client consultation, my hands are clean at this point. Just want to be clear on that. So we're going to greet our client and escort her to the work area. We'll assess the client's current style and determine the client's preferences. We'll assess the client's needs and the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, an infection or infestation like lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours, and we're going to consult on any known allergies. We'll consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters, and we'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers, and if the client is free from any of those contraindications, you can move forward with the procedure. So our client is good to go after her consultation, and so we're going to get her comfortable in the bed before we start the service and wash our hands once again. So we brought her to the bed that's ready. The towel is horizontal across the top. We are going to place that rolled towel under her neck for added comfort. We are going to put a headband on her to keep the hair out of the way of the lashes. And then we are going to also drape another towel over her clothing or décolleté. We want to make sure that nothing is exposed or could be exposed to any of the products that we are going to use. So what we're going to do now is wash our hands. So you get to the sink and you wet your hands and you find that liquid hand soap and you wash your hands all the way down to the wrists. You wash the back of the hands all the way down to the wrists. You're going to wash your fingers and the backs of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingertips and nails. Wash those thumbs really, really good. You're going to wash your wrists really, really good. And all of that, you're going to do a proper rinse under the sink for 20 to 30 seconds. Once you have done that, you can grab your disposable paper towels, turn the water off, dry your hands thoroughly, toss it in the trash. Once that's done, get your hand sanitizer and 70% ethyl alcohol, and that's how you finish your hand wash. Just make sure at this point that everything is really, really, really dry, because you want dry hands before you put on those gloves. That's a must. And then you can put on your disposable gloves, which of course we'll keep on the entire time. So I'm just taking a minute to do that. And then we're going to get our client started with eye makeup remover. So the first thing that we're going to do is remove eye makeup. So and just do as much as you need to do. To get everything off of your client. So if it means a couple passes or a couple times, that's okay. You just want to have a nice clean eye area to work on, clean lashes so that the lift works. Excuse me. And I just take my time to do it. And then I'm going to dry the area thoroughly as well. Dry the lashes, dry. Just making sure that everything is clean. And dry. Clean and dry. Clean and dry. Perfect. So what we're going to do now is we're going to put our iPads on. We're going to apply a little bit of that like Vaseline type product underneath the eye, and you are going to make sure that you are going to put the iPad up and completely cover up the lower lashes. You do not want the lower lashes involved in this service. So I'm going to do that first. We're just lifting the upper lashes, not the bottom. That would be very strange. So I'm putting on a bit of this, hoping that these pads stay down. Okay. So make sure that you get that lower lash covered up and down, everything down by the pad. I see. I see, honey. Sorry, my daughter's over here. Yes, I see. So make sure that's down and not moving. And then we're going to measure the rod that we're going to use to do the lift with to make sure it will fit. And I really only have one size that I'm working with here for the video. So we're oh, look, it's a perfect fit. Great. Okay, so once you've identified your silicone rod size, you're going to place a little bit of glue on the back of the rod to keep it in place, and then you're going to hold it down for 5 to 10 seconds. So we're going to pretend like we're putting a little bit of glue to the back of the rod, and then we're going to place it on the eye and get it down to that lash, and then we're going to hold it for 5 to 10 seconds so that it sticks. Now, unfortunately, this will not stick, but at least you can see the visual of what I'm doing and know that I know how to do it. So I'm going to get the other rod, silicone rod, and I'm going to place some glue on the back. And then I'm going to place it down to the end of the lash, and I'm going to hold it there for 5 to 10 seconds. Holding it in place, and we're going to pretend like it's held. I'll take you home after I do this video, okay? Here you go, buddy. Okay. Bored? No. There's things to play with at home, I know. Okay, so we're going to pretend like those are stuck. Now what we have to do is take a little bit of the lash glue and apply it to the top of the silicone rod, and this is where it's a little tedious because we're going to take our time to get the lashes to stick to the rod and separate them. Now my lashes are not going to stick to the rod because her lashes are not, because we don't really have that ability. So we're just going to pretend. I'm going to put a little bit of this on and then show you what we do, and I'm going to work on it for a while. This is where it's probably takes the most time. You're going to get your lash lift tool, and you're going to start from the outside, and you're going to work your way in, taking the time to get the lashes to stick to the silicone rod. And of course the silicone rod would be stuck to her lash or her eyelid, so this would not be like this where I'm holding it down and then combing up, but you can see just how I would comb it up like this, and some would stick, and then I would go back and separate. So this is where you have to be detailed, work really, really specifically, focused on sticking that to the rod, and then you will take a long time to separate each lash, make sure they're going in the way that you want them to stay, because however, when you put that lifting lotion on there, it's going to make them lift exactly as they look. So whatever direction they are, if they're clumped together or not. So this is where you take the time when you're having them go to the rod to make them look exactly like you want them to look. So I'm just going to make sure that I'm combing through them and that I like the look of them, even though they're not stuck to the rod. I don't want them to be clumped up. I want them to be facing the right direction. So I'm just going to take a minute to do that. As if they were on the rod. Because there's no going back. No going back for sure. This poor girl. So we're going to pretend like one is kind of done, kind of. And then we're going to go to the other side and we're going to put on a little bit of the lash glue so that it will then stick to the silicone rod as I comb it up and out. And I'll get my tool to then do that. Once again, I'm going to be working from the outside of the eye toward the nose, toward the inside of the eye. So I'm working from out to in. Okay, so this one looks decent. All right, so now it's time to apply our lash lift solution because we're going to pretend like they are attached to that silicone rod exactly as we want them to be. They look really, really good. And we're going to apply that lash lift lotion with an applicator brush. I don't have that, so I'm going to be using a Q-tip. We're going to pretend like this is my lash lift applicator brush, and I would be applying it from the root of the lash about 3/4 of the way up, no higher. And that's just because the end of the eyelashes are the weakest part. They're the part that's getting ready to come off, and you don't want to over process that. It won't look pretty. So just taking our time to do that on each side. And then if you want, or need to, you can go in and separate or line it up the way you want, because this is what's going to make them stay in that position. So this is where it counts right here. No going back after this one. So I'm going to do the same to the other side. Root 3/4 of the way up. and then I'm, making them, laying them out, making sure once again that they look exactly like I want them to. Okay. And then you would follow manufacturer's instructions on how long this will process. So we're going to say 5 to 10 minutes with this, depending on the strength of the lashes. Some lashes can process faster. So we obviously are not really doing it, and we're not going to, for the sake of the video, set a timer for 5 to 10 minutes and just sit here. But you would do that in service. So we're going to pretend like the time is up, and what we're going to do now is we're going to wipe off the Lash Lift lotion, and we're going to do it dry first and then damp. So, excuse me, I'm just getting a cotton round, and remember they would be attached to the rod, so I would be gently just wiping off the Lash Lift lotion with this dry cotton round. And remember, it is attached, so it's not like it looks right now. They would be attached to the silicone rod. And then I'm following with a damp. So I'm going to get one of these Q-tips, I'm going to make it damp, and I'm going to wipe off the lash to make sure I get all of it with the damp Q-tip. And I'll get another one for the other side. And then I'm going to go with another dry cotton round and just make sure it's nice and fully dry before we do our setting lotion part. Remember, once again, this would be attached to the silicone rod, so this wouldn't be a battle like what I'm dealing with right here. Trying to keep the rod in place, and that would all be there. Everything would be attached. You wouldn't have to struggle. It's just how you would remove. So dry, damp, and then dry. And then now it's time to get an applicator brush, and you're going to apply your setting lotion to the client's lashes. So we're going to pretend like this is an applicator brush, and I'm going in with my setting lotion. Same location, base to the 3/4. Just being mindful of where I'm placing it. And then while the setting lotion is on, I'm going to gently cover her eyes and let her rest. And You'll follow, once again, instructions for this, for timing. I'm going to say I'm going to let this process for 5 minutes. You could process it less for thinner hair structure. During the processing time, we're covering with this nice little coverlet so the client is comfortable. And so obviously we are not going to set a timer. We are going to pretend like 5 minutes has passed, and then I would gently go in and do like a gentle tap or touch touch the head so that they know you're coming in, just in case they've fallen asleep, and put this cotton out of the way. And then we need to remove our setting lotion. So we're going to start with the dry first, and we're going to do our dry. Just to remove that setting lotion. The first step of it anyway. And then we're going to get warm water on a cotton round, and we are going to remove fully the setting lotion, and then we'll get this rod out of the way as well. So you can either wiggle the lashes, you can also use a Q-tip in like little circular motion, because it's a little bit wetter, and it will allow you to get the lashes off, and then you'll be able to remove the rod, placing it to the side, and then you can remove the iPad for the trash. And you'll get another warm water for side 2, and you will remove that remainder of the setting lotion. And then once again, it's a little wetter, so you can remove the lashes from the silicone rod, and then that silicone rod will then be able to come off easily. And then you'll be able to remove your iPad. And then you'll be able to clean up around the client's eye. And then before they go, we're going to dry, and we're going to comb through, and we're going to present to them. So they're going to get to see how gorgeous they look. Because they really do look amazing. Okay, and let me just give it a comb through. And grab her little mirror so that she can see how gorgeous she looks. And it's like, oh, lelo, I love my lash lift. She loves it. So, you can remove your gloves. Taking off her towels and things, it's going to be time for you to escort her to the checkout. So you won't need your gloves. They would go in the trash, and that's where you're going to do your discussion about maintenance and aftercare. And then you can also get her booked for another appointment, which is great. Then, and she will want to because her lashes look amazing. Then you have another lash lift that is coming in 15 minutes. What are you going to do? You got to get back to that room, and you've got to do all the things to finish this out and get prepared for your next client. So we are going to review that. You're going to go to the room, and you are going to discard any single-use item that hasn't already been discarded. Maybe those under-eye pads or anything that you just threw on your tray. You got to get that in the trash immediately. Any of those little plastic cups, they all got to go. Then you're going to get your implements and get them in a closed container marked to be disinfected. You will get that laundry, the sheets on the bed and the headband, towels, everything you used for her, and you'll get that in a closed container until it's time to do the laundry. Then you will identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage. You'll wipe down the workstation and area with cleaning solution to remove debris. You'll identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in a salon setting to use in your cleaning and disinfecting. This point you have to put gloves on. So your gloves, a new pair of gloves are on. You'll follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You'll disinfect electrical equipment, store it in a clean area separate from other implements. Remove those gloves, throw them in the trash, and then you finish with your hand wash. So wet those hands, get that liquid hand soap. You're gonna wash the palms down to the wrists, and you're gonna wash the back of the hands down to the wrist. You're gonna wash your fingers and the back of your fingers. You're gonna wash between your fingers. You're gonna wash between your fingers and your thumbs. You're gonna wash your fingertips and nails. You're gonna wash your thumbs. And you're gonna wash your wrist. All of that for a minimum of 20 to 30 seconds, and then you're gonna do a real thorough rinse underneath the water. When it's properly done, get those disposable paper towels or a clean towel, turn the faucet off. Dry everything off. Throw those disposable paper towels away, or if it's a clean towel, it's now dirty, put it with the other dirty laundry in that closed container. Get your 70% ethyl alcohol hand sanitizer, wash it up, and then you're ready to go ahead and prep for your next client who's coming in for that next lash lift. And so that's the end of your video on lash lift.